Hello and welcome to the week with me, Pooja Avasti. A new variant of the coronavirus seems to be doing the rounds, and countries like Singapore are asking their residents to mask up. But is this a new variant? More importantly, do we need to be worried about it? We have with us today Dr. Ankita Baidya, who's the HOD and consultant for infectious diseases at the Manipal Hospital, Dwarka in New Delhi. We'll ask her all these important questions and address our worries. So now we hear that there is a variant of the coronavirus going around in countries like Singapore. First of all, is this a new variant or has it been around for a while?
So first thing we need to understand about these viruses that they tend to mutate. These are RNA viruses. So they tend to mutate with time depending upon the host pressure, the environment pressure, the antibody pressure that has been created with the existing strain. So this is a normal variation that we see time to time with not only with coronaviruses, but other different viruses also like flu virus and other different viruses. Regarding this variant, it is another mutation that has been occurred in Omicron variant of coronavirus. So that has been right now in scrutiny because as we have seen that there are rise in cases in certain part of Asia. So that's why it is important that we keep a check on if something new is happening or some new measures has to be taken on time without any panic situation. That is what I can say. It is just to monitor closely about these viruses. This is not a new virus as such. Coronaviruses had been since ages. COVID-19 was another variation in coronavirus as such. And this is a new variant, subvariant, I can say, of Omicron variant that we had seen earlier also of COVID-19.
So, as you say that this is under study, but whatever you know about it as of now, would its symptoms be any way different from what we experienced during the COVID-19 pandemic?
So, as we had seen, different strains of COVID-19, especially the Delta variant, was really bad. The similarly, Omicron variant had a milder disease, but still patients who were susceptible, like elderly population, patients who were immunosuppressed due to some cancer therapy that they are undergoing, or pre-existing lung disease. So those patients have to be cautious. Those people has to be cautious, especially if such patients get such kind of infection, including coronaviruses. So they can land up into a bad situation of requiring oxygen or maybe a prolonged illness. So these subset needs to be in caution. Otherwise, the symptoms per se of coronavirus is just like any viral infection that we see. Like we know about fever, sore throat, running nose, nasal congestion, cough and cold like symptoms. So these symptoms are there with coronaviruses. The same symptoms we are observing in this current outbreak also. The concern is that in the Asia there are reports of hospitalization and deaths that are coming. But yes, we need to analyze what kind of patients had actually suffered this severity of illness. So it could be like patients who were elderly, already pre-existing lung disease. So and that's why because of underlying compromised status of the health, they had a severe viral infection and had succumbed to the illness. But as such, it is for a common public, like a person who is a healthy adult, this might not be that concern that you need to panic as such. Yes, but close watch is always required whenever we see any outbreak of any new infective etiology.
Right. So now all of us are, of course, vaccinated. We've had our double doses. Is there a need for a booster dose for certain sections of the population or a flu vac for certain sections?
So basically, right now, regarding a booster dosing of coronavirus related vaccine, is there is no clear-cut recommendation about that. So as such, there is a natural immunity that is ongoing because of the natural infection that is happening in the society. Unnoticed, milder infection, people are getting antibodies, and as such, this decreases the transmission of the virus also and the severity of the virus also. So this is called herd immunity. The concept is herd immunity. As such, there is right now no clear-cut recommendation, no panic for the booster doses of coronavirus vaccines. As such, in the current scenario.
Right. So countries like Singapore, for instance, are asking citizens to mask up. Do we also need to mask up in crowded places just to be safe?
So yes, if somebody is having, especially like close crowded place, a marketplace which is actually crowded, and somebody in your vicinity is sneezing, coughing, he may or may not have fever. You don't know the person who's standing next to you in the market is having fever or not, but he's coughing badly. So this is how this infection can get transmitted. So if you are, somebody is going to a place where it is actually crowded, the distance cannot be maintained, it is better to mask up, because that's the personal way to take care of yourself also and your family also, because these viruses spread in the close proximity. So if you catch and it is a milder illness for you, you go home and there is an elderly parent there, so this infection can get transmitted like that. So if it is, yes, crowded marketplace, yes, you should be wearing. But if it is a normal day out, going to a restaurant where you can maintain distance, like then it is not required as such until you are having symptoms. So a person who is infected wearing mask decreases the chances of transmission around 75 to 80%.
Right, right. So when, of course, the COVID-19 pandemic came around, there was a long list of home remedies also which were suggested. So in our daily life, are there any recommendations that you would make just to keep our immunity up and working?
So with these two important vitamins, which we commonly see deficiency, is the vitamin C and vitamin D. And these are very good immunomodulators, are very good immune boosters for all of us. So vitamin D, yes, you should be keeping up with your vitamin D levels in the normal level. So if you don't know exactly, you can go and get yourself checked for that. And if it is low, you talk to a doctor and get the supplementation done. Vitamin C, you can take good antioxidant rich, vitamin C rich food. There are also some supplements which is available, but yes, after consulting doctor only one should take that. But natural food like citrus fruit, amla, these are all lemon, these are all vitamin C rich food, and this should be consumed on a regular basis.
But here, doctor, I would also like you to please tell us that during the pandemic, again, we saw that people were overdosing on these vitamins, which also led to toxicity of specifically of vitamin D. So we should
So
not be taking it without a doctor.
over the counter, yeah. So it should not be over the counter. First, get the levels checked, then consult with the doctor, and then check it. Don't self-medicate. That's a very dangerous thing to be done.
Right. Is there anything else that a lay person should know about this virus at the moment?
So whatever we have practiced in 2020, 2021, those years should not be forgotten. And we should be practicing that in a healthy way. So as like washing our hands frequently. And if somebody is sick in the vicinity, then mask up. If you are sick, then isolate yourself, mask up and show to a doctor, and then uh, whatever medication and precautions are required, that has to be done. So these basic precautions taken, because these viruses spread in, these are respiratory viruses, spread in close proximity. So if at the personal level, if we can do this, so this can actually help to curtail the transmission of the virus.
Finally, have you seen any uptick in cases of, let us say, flu or respiratory infections of late?
So we have seen a lot of flu cases this year. So flu is the common infection we check also. So we, and these infections are very similar to what we see with the COVID. And flu is a vaccine preventable infection. We have a definite antiviral for that, given at right time. So if somebody is diagnosed with flu, so it is always better to get checked again.
Right.
If at all there is flu virus or COVID or anything, any other respiratory virus, if any symptoms are major symptoms are there, or some health related concerns are already existing, because then it can go bad. So normally, as we commonly know, common cold virus, common cold infection may not go bad, but yes, if underlying health concern is there, then it should be checked. And flu viruses circulation is always there in the community. It again, it's a virus, RNA virus. It again changes its face time to time. So that's why every year the vaccine is new, which usually comes in the month of August, July end or August, and that is how every year it is recommended. Person who are recommended for vaccination, they should take it annually.
Right. So right. So, of course, the vaccine comes in when there's seasonal change and when the chances of getting it. But you haven't seen any cases where this coronavirus variant is manifesting itself as of now.
So that is what, Pooja, we need to, the symptoms are so similar that we need to check for the virus itself. So if we send a COVID-19 PCR, then only this can be identified. So first thing is, and especially when in the middle of the era, when we were seeing very less number of COVID-19 cases as such, and it was not being reported commonly, so we were not actively looking for it because symptoms are very similar. We were getting a lot of flu cases as such, and similar presentation as this. Since now we are seeing an outbreak, so yes, a patient who present to the hospital or somebody at home is there who is having viral-like symptom should be tested for COVID-19, especially if there is certain reason to uh, like health-related concern, as I mentioned, diabetic, heart disease, pre-existing lung disease, hypertension, elderly patient, so they should be checked. But no, it is not routinely recommended that we go for COVID-19 RT-PCR for all the patient who comes to with cough and cold and fever to our room. So
Right.
that's how
So
it is.
finally, on a scale of 1 to 10, how worried should we be, or we should not be worried at all and just be cautious?
So the number is difficult to fix, but what I can say is we should not be worried, but we should be prepared for all the things. Now we know how the COVID virus spreads, so that can be taken care of by taking individual actions on that. So we don't expect all the time government to come and say wear the mask. That is how we have learned in the days now. And practicing basic hygiene, respiratory etiquettes will help to curtail this virus. Panic is not the answer for this, but yes, preparedness is definitely should be.
So thank you so much for your time, Dr. Baidya, and putting our tensions and our questions at ease. And we hope this passes as soon as it has made an appearance. Thank you so much for the week.
Okay, have a good day.